And Dr. Ackerman is back with one of his patients and clients, Rita Hedges, to talk about the treatment for neuropathy. Hello to both of you.
Hello.
Good morning.
So how did you two meet? How did you get connected?
I saw his commercials on TV and decided to make an appointment.
All right, so when was that, Rita?
That was about 3.5 months ago.
What took you there in the first place?
Well, the condensed version is I had been having to sleep in a recliner for 3 years because of the burning and pain and everything in the bed. When you're in the bed, that's the worst time during the night. And I had tried everything over the counter. I had been to 2 or 3 medical doctors who said there's no cure, there's no turning back. Once you have the damage done, it's done. So I decided to try one more time with him, and I was very, very skeptical because nothing else has worked. But he was very reassuring, and his calm demeanor, bedside manner was really nice. His office staff is really nice. And so I tried his regimen. He told me that he would try to make it where I could sleep in a bed, you know, after his treatment, which I really didn't know if I believed him, but actually it's been 3 or 3.5 months that I've seen him, and I'm can sleep in a bed all night, no pain, no burning, nothing. I mean, it actually really works.
Well, what a testimony.
It is like a miracle. I mean,
well, yeah. Well, and he's talked about this so often, about when people say there's nothing you can do, and to take that step, to, you know, that leap of faith to say, I'm going to try this one more time when you're at your rope's end anyway.
Right.
So these are the stories that you like to hear and share.
It is, and it's what's awesome is the listeners out there, when they hear from a real person versus just me, makes more of an impact.
Well, absolutely, because they see you in the grocery store doing your job and out there and can ask those questions of you. So what was it like to get started at home? Because it's a time commitment.
Well,
right?
it is. If you have to do what he says, you have to do the regimen. But if you want to get better, you'll do it, and it works. There's 3 or 4 things you have to do at home every day, and you can do it, you know, while you're doing paperwork or on the computer and things like that. And then you have to go to his office a couple of times for the first 3 months for just a 10 or 15 minute treatment. It doesn't take that long. And then he follows you through until even if it's a year or however long, you keep, you know, going to see him for follow-ups. So
when in patient's case like Rita's, will she continue to use this protocol all of her life, part of her life? Will it reduce any at all, or? So
we'll monitor until she kind of plateaus. She'll improve to a certain amount, and then once she gets to that point, then there'll just be a little bit of maintenance stuff that she can do ongoing, but it doesn't take much time to do that. And all that stuff's done at home as well. And then none of this stuff hurts. It's not uncomfortable. You can do it watching TV, reading a book, playing on your phone, whatever you want to do.
Yeah, I mean, really, you know, George is one of your patients too, my husband, and he's doing that, you know, while he's at the computer.
Yeah.
And it's very, like, he's research-based, and he's always looking for more modern, he's always updating his education on this to bring more modern technology and things that helps. He doesn't just say, here, go do this at home. I mean, he's, you know, meets with the other people in the country who are on the front lines of this.
Absolutely, and that's important to know, because that just builds the trust and the confidence. And congratulations, Rita. I'm so happy for you. Dwayne, I'm happy for you too. Call Dr. Ackerman. He can help. We'll be back with more lifestyles right after this. Stick around.